3.
Hello, this is Mackenzie Zuber, and I'm here with my volunteer, Cindy, who is graciously going to help me do my head-to-toe physical exam. So we've had her empty her bladder, and she has put on a gown for us. We took her vital signs, including her blood pressure, her pulse, her respirations, including her temperature. We also took her height and her weight, and we examined her vision via the Snellen chart at 20 feet. And now we are going to start with her head and face. And we will begin with inspecting her skin and skull, and then we're also going to throw in some of the cranial nerves while we are in the head region as well. So Cindy, thank you for being my volunteer. I'm going to start with touching your head, your face, your neck. I'm going to feel for symmetry, any abnormalities from one side versus another.
Okay.
And tell me if there's anything uncomfortable or painful. All findings look normal. The symmetry is present and there's no signs of abnormalities. Now I would like for you to, we're going to check some cranial nerves, and we're going to have you clench your teeth for me. Okay. Squint your eyes. Wrinkle your forehead. Smile. Stick your tongue out. Okay. Looks like those cranial nerves are intact with no signs of any issues. Also, I want you to puff your cheeks out, please. Perfect. Okay. And all that looks good. So now we're going to start looking at the facial bones, the temporal mandibular joint, as well as her sinus regions. So I'm going to poke around on your face a little bit. You let me know if there's any pain, okay?
Okay.
Any tenderness or pain?
Mm-mm.
Perfect. Now I'm going to feel your joint that is used when you open your jaw. So open for me. Close. And one more time. And close. Perfect. Her temporomandibular joint is intact. I felt no clicks, rubs, any issues. Her sinus regions were all intact with no tenderness. We're also going to check for light sensation in areas on her face. I'll have you close your eyes for me. And I want you to tell me what part of your face you feel these sensations.
Forehead, chin, left cheek, chin, right cheek.
Perfect. Our light sensation is good. Now we're going to go to the eyes and begin with examination of the eyes. We're going to start with inspecting the eyes and looking at the sclera conjunctiva. We're going to look at the lacrimal apparatus and perform a near vision screening. Any pain or tenderness?
No.
Okay. We're going to do a near vision screening at 16 inches.
Okay. Glasses or no?
Let's do no glasses to
No
start
glasses.
with. What is the lowest line you can read?
The lowest line I can read well is this one, 9B MCL.
Okay, that's 20/100 with your glasses now.
Okay, I can read this one, ORDFMP. Well, I can probably read the next one too, WJFXGH.
Perfect, that's 20/30 with your glasses. Good job. Okay, now we're going to continue with her eye exam, and we're going to check. I'll have you go ahead and take your glasses off if you don't
Okay.
mind.
All right.
And I'm going to check your pupillary response to light.
Okay.
Good eye movement, good pupillary response. The pupils are equal and reactive to all of the light. Now we're going to assess her extraocular vision. Okay, just look straight ahead and let me know when you see the movement of my hand. Perfect. So her extraocular vision is intact with no signs of abnormalities. Now we're going to do a bone versus air conduction test. for hearing. So I'm going to place this on your mastoid behind your ear. I want you to tell me when you can no longer hear it at that location. At that point, I'm going to put it in front of your ear, and I want you to tell me when you can no longer hear it at that point as well.
Okay. Okay.
Can you still hear it at that
Mhm.
point? Perfect. Her air conduction versus bone conduction test is conclusive that it is normal. So we will move on to her nose, and I'm going to take a look at her the inside of her nose and check for any abnormalities there. The septum is midline and the turbinates are pink and slightly swollen. Have you had any trouble with any drainage?
A little tiny bit.
Okie doke. So that could very well be an issue with the pink turbinates. Also, we're going to look at the ears. We need to look in the ears and check her tympanic membranes. I'll use a different tip. So we will start with your right ear. Right tympanic membrane is intact. All landmarks are able to be seen. The left eardrum is intact as well, with all landmarks able to be seen at that point. And there's no signs of infection at the eardrum level, and it's clear, which you can see the landmarks behind it. So now we're going to take a look at the mouth and the pharynx. So I'm just going to take a look on the outside. Now if you'll just open your mouth, I'm going to look at your teeth, your tongue, right inside your mouth. You've had some dental work done.
Mm-hmm.
You see a dentist regularly?
Yes.
Okay. Now we will take a look a little further in and go back to the throat. I'm going to have you open your mouth, stick your tongue out, and say "ah" for me.
Ah. Ah.
Gag reflex is present. Thank you. Sorry about that. As well as this tongue remains midline. Okay, the next thing we're going to look at is the neck. I'm going to make sure everything is symmetrical. Okay, now we're going to feel around a little bit for some carotid pulses, as well as some of the lymph nodes that are located around the neck. First, I'm going to feel for pulse. Now I'm going to start with your occipital lymph nodes. And move on forward to your auricular lymph nodes. I'm looking for any soreness, any larger lymph nodes, and symmetry of the lymph nodes. Tonsillar lymph nodes, the submental lymph nodes, and some mandibular lymph nodes, as well as the cervical lymph nodes, the clavicular lymph nodes. And those are negative. All were symmetrical, and there weren't any that stood out at all. Now we're going to do I'm going to listen to the neck for any pulsations or any bruits or things of that nature to her carotid arteries. Okay. I'm going to take a look at your trachea. It looks good in midline. And your thyroid. Can you swallow for me? Perfect. I'm going to listen. Okay. No abnormalities noted with, where's my earring, with the carotid pulse or anything of that nature. So now we are going to look at the upper extremities, and I'm going to take a look at your head and your arms. I'm looking for any abnormalities in the symmetry or anything that stands out that is not normal. I'm going to have you hold your arms out for me. Sorry, you may put your glasses back on.
Okay.
Okay, hold them out in front of you. Okay, can you push down on my hands? Perfect. Can you raise up? Perfect. Okay, now relax at your side. I'm going to look for your brachial pulses. That one's good. I'm going to look for radial pulses. That one's good. Look for brachial pulses on this side. And radial pulse on this side as well. Okay, pulses are intact and 2+, no bounding, no irregularities noted, and they were equal on both sides. So now we're going to check on the lungs. So I'm going to start with palpation of the anterior side. And take a deep breath for me. There's equal expansion anteriorly, so I'm going to check posteriorly. Deep breath. Now I'm going to palpate for tactile fremitus on the back and on the lateral chest walls. And diaphragmatic excursion. I'm going to have you take a big deep breath and hold it in for me. And now exhale. Okay, and that is normal as well. Now we're going to listen to all of her lung fields posteriorly. And we'll go in a systematic fashion. And I will listen laterally. I'll have you hold your arm up. Big breath for me. And your other arm. Okay, your lungs sound good posteriorly. I'm going to listen anteriorly as well. Deep breath. Okay, now we're going to move on. Our lung sounds were equal on both sides, bilaterally. There were no abnormal breath sounds. All lung fields were clear. So now we're going to move on to the heart, and we're going to inspect and I'm going to go ahead and have you lay down so I can inspect the chest and the abdominal area and listen to some things in your belly. Let me pull this out for you. Oh, sorry.
All right.
You doing okay?
Yep.
Okay. Inspect the abdomen. Do you care if I pull your pants down just a smidgen? Okay, by inspection, everything looks good with the chest and the abdomen. So now we're going to feel around with a little bit of the percussion for some liver borders. Noting the dullness of where the liver borders will extend. And I'm going to also look around to the splenic area for the splenic borders. I'm going to listen for bowel sounds in all quadrants. I'm going to listen for pulses. I'm going to listen with the bell of my stethoscope for the aortic area. The renal arteries, which lie on the sides of the aortic. The iliac arteries, which are in the level of the umbilicus. Just a little bit below the umbilicus. And then the femoral arteries. Okay. Miss Cindy, I'm going to listen to some more heart tones.
Okay.
I need to do some anterior heart tones as well. So to start with, I'm going to do the aortic area for heart tones. It lies about the second intercostal space, and then I'm going to over to the pulmonic area. The aortic lies at the second intercostal space on the right side. The pulmonic is on the left side. And then I'm going to look for Erb's point, which is going to be in the third intercostal space on the left side. I think I switched my bell around too much. I'm not hearing very well. There we go. I'm going to go back to Erb's point and listen at that. And then we'll do the tricuspid area, which is going to be in the fourth to fifth intercostal space on your left side. And then the mitral area is also in this area as well. Okay. Thank you, Cindy. I'll let you sit back up here. And now we're going to inspect your feet and legs. Get you covered up here.
Thank
Oops,
you.
I'm sorry. Okay. I'm going to take your sock off. That's okay. Okay, and we will check for some reflexes now. First, I'm going to check your brachial reflex. I want you to hang your arm loosely. let me just hold your all of your arm weight. I want you to bend your arm just a little bit. I'm looking for this tendon in here.
Okay.
Did you feel these tighten up?
No.
Okay.
Yeah.
I think we found it. I think we found it. Okay, we'll do this side as well. And just lay your arm loosely.
Okay.
Perfect. Looking for that ligament in there.
Mm-hmm.
I think I missed that time. There we go.
Got it.
Perfect. Okay, now I'm going to look for the knee reflex. I'm going to look right below your kneecap. I'll have you look at the ceiling.
Hmm.
Got it.
Got it.
Look on this side. Perfect. Good job. Now I'm going to look a little bit lower, and we're going to look at the Achilles tendon reflex. So I'm going to hold her foot in my hand. Just let it hang kind of loose. And it jerks up for me.
Mm-hmm.
There we go.
Okay.
Okay, that's perfect. Okay, so all of our reflexes are intact. There's no edema. All of our extremities have good hair dispersion, good color, good temperature. So we're going to check for pulses as well. Now I'm going to look for popliteal pulse behind the knee. And then we need to do the posterior tibial as well. Okay, go ahead and relax. Okay, all pulses were equal on both sides, 2+ with no bounding, no irregularity noted. So now we're going to look at her muscle strength. Let's do your we did your upper extremity muscle strength, I do believe. So now I want you to push against my hands. Perfect. Now pull back. Okay. Can you push up against my, good job.
I'm a little weak there.
I think I would be too. I understand completely. Okay, now I'm going to take a look at her spine and find some landmarks back here. Her cervical spine is midline, as well as thoracic and lumbar. Okay, any numbness or tingling in your extremities?
No.
Okay. This concludes our exam, Miss Cindy. I want to thank you for volunteering for me.
You're welcome.
And thank you.